All right. Good afternoon, everyone. I'm Jennifer Rice Epstein. I'm the Public Affairs Specialist with the City of Long Beach. I'd like to thank everybody for coming out today. I'd like to welcome everyone in today's briefing on coronavirus. I'd like to thank the Health Department for hosting us, and I'd also like to acknowledge Herlinda Chico from Supervisor Hahn's office. Thanks so much for coming out today. I'd also like to thank Acting City Manager Tom Modica for being here, and Mario Cordero, the Executive Director for the Port of Long Beach. I'd also like to thank some public safety officials that we have with us today. Deputy Chief Ray Tui from the Fire Department, and we have Commander O'Dowd from Police Department, and Francisco Soto, who is the Disaster Preparedness Officer for the City of Long Beach. Today you'll be hearing from Mayor Robert Garcia, City Health Officer Dr. Anissa Davis, and Communicable Disease Controller Emily Holman. After the presentation, you'll have a chance to ask questions of our presenters as well as public safety officials here today. If you're tuning in via Facebook Live, add your questions to the comments section and our health department will respond in the comments. Now I'd like to welcome Mayor Garcia, who's going to say a few words.
Thank you, and thank you all for coming to this briefing. I know that this is a really important topic right now, not just here, of course, locally, but certainly across the country and globally. We know that a lot of people across the city and really the region have a lot of questions and concerns as it relates to the coronavirus. And we really want to make sure that people, especially here locally, know what the city is doing, know that our public safety team is on this issue and discussing it every single day, all the time, and what really we can do as a community to kind of address this issue holistically. I want to say first, it's very important to note that Long Beach is prepared, and we are aggressively monitoring all the developments that are happening in California, across the country, and of course, really around the world. Long Beach is a global city. It's a city with its own airport and a port, which is the second largest container port in the United States. And so that in particular is of interest to us, and we're going to discuss that a little bit today. This is a global public health crisis, and we have to take this very seriously. We do know that the governor addressed this issue today here at the state level, and we're very grateful for that, and we're very confident that the state is doing everything that they can. But in order to address this issue precisely, cities, counties have to also partner and get involved. Now, we know that there are currently no confirmed cases of the coronavirus here in Long Beach. I think that is important to note, but we're not taking anything for granted, and we're working very hard. The city is currently in constant communication with the Center for Disease Control and Prevention, the CDC, and that is happening on a regular basis, and we're getting updates and reports daily and multiple times a day. The California Department of Public Health, the LA County Health Department, our local hospitals and emergency rooms here in the city of Long Beach, our urgent care centers, and so we're also communicating with all of them. All of our local providers so that we can ensure that we're all communicating, and our university partners, schools and colleges, so that they are aware of what the risks are and what we're doing. We're also pouring all of our resources into keeping Long Beach safe. So what are we doing currently, and what are we going to do? We have set up an incident management system within the city to deal with this as we would with other possible emergencies. We are operating our Health DOC, which is our Department Operations Center, which is kind of a joint command operations center for the city to monitor this. And we're tracking a significant amount of data that is coming in on a regular basis, really worldwide data that's coming in. But we're being very proactive. So the Long Beach Airport, for example, is undergoing extra cleaning, maintenance, and disinfecting of any areas across the airport. That's something that we are doing actively. I will say that we're making sure that hand sanitizer and cleaning materials are being made available in every single public facility, especially those that is of high interest to the public. We're working with our major employers and businesses to give them workforce guidance as well. And as it relates to the Port of Long Beach, our chief executive here is from the Port of Long Beach. There is a lot happening as it relates to the port. As you're probably aware, this is affecting worldwide cargo. But most importantly, it is also changing some of the process that's happening at the Port of Long Beach. Currently, vessels that are coming in with workers from China are being asked to remain on the ships. They are not leaving their vessels as in the past there was opportunity to do so, and that is being monitored by the port closely, as well as our federal partners. So these steps are aggressive and certainly appropriate, but we also want to make sure that we are following some of the basics, and that is to ensure, I ask particularly the folks here in Long Beach to be vigilant, to understand that we should be washing our hands with soap and hot or warm water. We got to make sure that we're not touching our eyes, nose and mouth with unwashed hands, that we're sanitizing appropriately. And most importantly, if you are sick, please stay home. And before I turn this over to Dr. Davis, I just want to also let the community know that the city is taking this very seriously. I am taking this very seriously, and I think this is a global health crisis that we have to be engaged, and I ask everyone to stay engaged and to communicate with their family and their community. And so I'd like to turn this over to Dr. Davis, who is going to give us a little bit more of an update.
Thank you, Mayor Garcia. Are you able to hear me okay with the microphone? Is it okay? Okay, thank you. So I'm just going to read some remarks about the situational update globally, and then here in Long Beach, nationally, and in the state. And then we'll kind of go over what Long Beach is doing, and then I'll turn it over to Emily to kind of get into some more details. So the respiratory illness COVID-19, which was formerly known as 2019 novel coronavirus, has quickly spread after originating in Wuhan, China, in Hubei province in December 2019. There have been over 81,320 cases and 2,770 deaths reported globally. The vast majority of those cases are within mainland China. While the number of new cases within China has plateaued and begun to decline, there has been a sharp increase in cases outside of China in countries such as Italy, South Korea, and Iran. Currently, there are 15 cases of COVID-19 confirmed in the U.S. This number does not include those U.S. residents who were repatriated on chartered flights, nor does it include the U.S. residents associated with the Diamond Princess cruise ship. Locally, there are no cases in Long Beach. There is one case in Los Angeles County and one case in Orange County. Of note, yesterday, the U.S. Centers for Disease Control and Prevention confirmed the first case in the United States of possible community transmission of COVID-19 in California. The individual, a resident of Solano County, had no known exposure to the virus through travel or close contact with a known infected individual. Over the past several weeks, Long Beach has been monitoring travelers returning from mainland China for 14 days after arrival to ensure they do not develop symptoms of COVID-19. Those who are undergoing monitoring are required to avoid school and work and are asked to stay at home for the duration of the 2 weeks. To date, we have received notice of 64 travelers and have actively monitored 8 individuals. None of these individuals have developed symptoms at this time. The number of travelers returning to China has greatly decreased in recent weeks, as most people who desire to return to the U.S. from China have already done so. Because of the expanding nature of this outbreak globally, the CDC has announced that the U.S. could eventually see sustained community spread of COVID-19. While the outbreak is not currently considered a global pandemic, both the World Health Organization and CDC have noted that it could reach pandemic levels. At this time, public health response is focused on the goal of detecting and minimizing introductions of the virus into the United States so as to reduce its spread and its impact. To that end, the Long Beach Department of Health and Human Services has ramped up many of its preparedness activities. Our department's Public Health Emergency Management Program plans for various disasters on an ongoing basis, including pandemics. When the H1N1 flu pandemic hit in 2009, we were able to effectively contain the number of illnesses with mass vaccination and public health measures. So we'll be able to take that experience to combating COVID-19 here. Our staff is prepared to activate mass vaccination clinics known as points of dispensing, where we give hundreds of flu vaccines in a short amount of time out in the field. These responses are exercised on a regular basis. We work very closely with our partners locally and in the region to ensure that we are ready to respond to any public health emergency. So now I'll turn it over to Emily Holman, our Communicable Disease Controller, to discuss our Health Department's COVID-19 preparedness and response activities.
Thanks, Doctor. Okay, we are doing a great deal of work right now to prepare in case this does become a pandemic. Just some of our activities include, we're working very closely with our medical facilities, so our hospitals, our emergency departments, our urgent cares. We're in constant communication with them, answering questions, clinical questions, evaluating patients who may qualify for COVID-19 testing, things like that. We're hosting a meeting here next week with our hospitals, our infection preventionists, and our emergency departments to discuss updated guidance and answer questions for them. Another thing is we're staying up to date. So this situation is rapidly evolving, and every day there's new guidelines or new publications that come out with more information on this virus. And so we have daily calls with CDC, with the state, with the California Department of Public Health, and even with our neighboring jurisdictions, with LA County and Orange County, to discuss changing guidelines and how we implement those in our own cities. Day and night, we are reading the most recent publications that come out on a daily basis to try and understand the disease better so that we can apply that into our control efforts as well. And like Dr. mentioned, we do have pandemic plans in place. Our public health emergency management, they plan for this even when there's not a pandemic looming. So we're just looking at that extra carefully right now, and we are updating that constantly. In terms of working with our Long Beach City departments, again, we're keeping them updated. Just this morning, we had a call with the Ports Risk Management to discuss, if this does become a pandemic, where does that lead us? What does that mean? And like Mayor Garcia mentioned, in our city departments, we're now providing hand sanitizers in places where there's the most public interface. We're getting in contact with our business partners in large event venues to discuss mitigation planning and preparing for worst-case scenarios. Finally, we do have a great website up. I just wanted to plug that, longbeach.gov/COVID-19, but it does have the most updated information. We keep a daily case count for the U.S., California, and locally, and we do have information for both providers and the public. And finally, we continue to plan for the worst case scenario. Among our staff, we do have the expertise and the ability to prepare for this pandemic. With that, I'll turn it back to Dr. Davis with the final message.
Thank you, Emily. So there's a lot that's still unknown about COVID-19. Currently, there's no vaccine for this virus, and there's no therapeutic medications to treat it. However, we do know that making sure you wash your hands frequently, that you're covering your coughs and sneezes, that you're staying home when you're sick, can lessen your chances of getting this respiratory virus as well as other respiratory viruses. Getting a flu shot is important to prevent that respiratory virus. And if you don't have respiratory symptoms, then a mask won't prevent you from getting sick. So if you don't have symptoms, you don't need to wear a mask. The Long Beach Department of Health and Human Services will continue working with our city department partners and other local stakeholders to address the possible introduction and spread of COVID-19 in our community and ensure the health and well-being of our residents. Thank you.
We'll take a couple questions if there's questions for any of our experts or anybody here at the table.
Doctor, you've indicated while we don't have a vaccine yet, you've also mentioned the possibility of implementing mass vaccination protocols. Have we got logistical matters settled out on that, where you would send people, maybe set up football fields, parks, whatever? Has that worked out with fire department, police department? And is there going to be a way of communicating to people saying, we have a vaccine, if you need it,
Yes.
here's where to go, days, times, everything else like that?
Right. So that's what we've been practicing and planning for since before 2009. So that's already set up and operationalized. We practice it every year with our flu pods, points of dispensing, where we give hundreds of flu vaccines. We've done drive-through where we can do, numerous people in a very short amount of time. So we've already got set up like what kind of staff we need, the venues sorted out. We talk and work with police and fire. We have help with traffic, messaging, working with disaster prep to get messages out there. So we're set. Like once the vaccine is ready, we wouldn't have any problem.
Are we talking about the ability to dispense how many and how fast a period of time? Let's say 72 hours.
How many we could do in 72 hours? I mean, I would say thousands.
Tens of thousands.
Yes.
Let me go to another question over here.
Since we now know that this Northern California woman is a possible community transmission, she got sick around the 19th, she wasn't tested until the 23rd. So that's a 4-day period where she was exposed to the community. Has that changed the protocol on who gets tested in your hospitals here?
So the CDC is who controls the protocol of who they recommend testing, and they, up until the very near future, were the only ones doing the testing, and it has changed the protocol. So it is, they've widened the geography of who they consider adequate for testing. So it used to be just mainland China, but now they've widened that to mainland China, Iran, South Korea, and Italy. And it could be that this continues to evolve and change. This is a very novel virus. We've only known about it since December 31st, so there's a lot of changes that are happening very quickly.
Any other questions?
Is there a working theory as to how this woman could have gotten COVID-19?
Right now, I think that's part of the investigation, is to try to go back and make some connections to see how it could have happened.
Some people are going to try.
Actually, go ahead.
You said anybody coming from China in any of the vessels through Long Beach has to stay in their ship until they leave. How are you guys monitoring, who needs to stay there and the fact that they stay there?
Yeah, I'm going to have our chief executive at the port answer that question with Mario Cordero.
Yes, thank you for the question. We're working with the Coast Guard, the federal agency that's within their purview. They're the ones that are monitoring and enforcing the regulations in place right now. And one of them, of course, being that if it's a vessel coming from China, if a vessel comes from China with that crew, they have to remain on the vessel. So,
How long has that been in place?
pardon me?
How long has that been in place where you've required them to stay on board on a vessel?
The Coast Guard implemented that, I think, about maybe a week and a half ago, when it started getting a situation in terms of what we were seeing here as it relates to China. But I think the Coast Guard, I'd have to say, was very proactive on that. And at this point, again, that will continue into the near future until sometime this is controlled.
Any other questions? Sir, did you have another question or no?
No.
Okay. Let me, yes.
Are you advising people if they wake up and have cold symptoms to come in and get tested, or what should people do if they think they might have it?
So they can talk to their doctor, and then their doctor will usually call us and give guidance, or else they'll go on the CDC and they'll kind of know what questions to ask the patient. And then we also have a number that people can call if they have questions, and we can help kind of guide things and go through the questions and decide what the next appropriate steps would be.
Okay. But do you have any tests for the virus? Because apparently they're in short supply.
So right now, most of the testing is being done at the CDC, but we're the kind of gatekeeper. So once we talk to the patient, and if we decide the patient should be tested, then we would collect the specimens. The specimens would come here, and then we would forward them on to the CDC, once the CDC agrees that the patient should be tested.
Any final question or two?
Is there anything that you're going to be putting out either on the web or other means of getting to people's attention, a simple checklist that if you get sick, and the following factors are a part of what your illness is, A, B, C, D, E. If you have A and B, you're fine. If you get down to E and you're checking every box, that's when you should be calling your doctor. That's when you should be worried.
So we have some of those things already on the website. There is a flyer that kind of says, you know, how do you get coronavirus and what things to do.
This way?
Yes.
And of course, the website is longbeach.gov. You can get to the health department site from that website. But we encourage people to just remain in constant communication on this issue, and the city will continue to monitor and to put out communication. And also, please note that those that are just this morning, certainly we had some conversations. I had conversations with some of the supervisors in LA County, and we see what's kind of happening with some of the emergency declarations that are happening statewide. And so we're all working together in conjunction to ensure we have a unified approach. Thank you very much. And
Can I have one more question? I'm sorry. Is there anything about COVID-19 that manifests differently than just the flu? Like, how would people know, okay, this might be something totally different?
So a lot of times it does start basically the same way. So you have a fever and cough and maybe a runny nose or sore throat, maybe some diarrhea. So a lot of times it looks just the same, and it's usually by talking with the person that you can kind of drill down to see if maybe they would be at higher risk for COVID-19 versus something else, and then kind of go from there. And then you can also test. There's panels of respiratory viral tests that you can do, and so you can kind of rule that out as you're working at the patient.
You look for ordinary flu,
Right.
and then if
Right.
it doesn't come up, then it's
Right.
more
Then
likely.
we get a little bit more suspicious, yeah.
well, thank you. And before I close, I'm going to make some brief remarks in Spanish. So if you need anything in Spanish, I'm just going to condense some of the information. I know-
Hold on, please. I just want to.
Okay, and then we'll wrap up. Ready?
Alcalde, ¿puede incluir lo de los barcos también?
Sí.
Gracias.
Mario, voy a tener tú incluir los barcos del puerto, ¿ok? Gracias por estar aquí hoy día. Sabemos que hay muchas personas que tienen muchas preguntas sobre el coronavirus y queremos que la gente sepa que la ciudad de Long Beach y los doctores y la comunidad acá estamos trabajando para que la comunidad sepa la información y que lo que está haciendo acá en Long Beach para que estemos seguros y para que la gente esté seguros en la comunidad. La ciudad está preparada y además estamos vigilando los desarrollos que están pasando acá y en todo el mundo y el país. Sabemos que acá desde hoy han habido 9 casos acá en California y 15 en los Estados Unidos. Pero acá en Long Beach todavía no hay casos confirmados, pero todavía estamos trabajando muy fuerte para que la comunidad sepa la información. La ciudad está en comunicación con el Centro de Control y Prevención de los Estados Unidos, el Departamento de Salud Pública de California, hospitales y los colegios, escuelas también acá en la comunidad. Estamos continuando a ver lo que necesita la comunidad para poder estar acá en buena salud. Estamos preguntando y diciendo a la gente que por favor sepan que es importante que laves las manos con agua y jabón por 20 segundos lo mínimo, que traten de no tocar sus ojos o la nariz o boca sin lavarse las manos. Y más importante, por favor, si estás enfermo, tienes una enfermedad, por favor, quédate en la casa y ve a ver al doctor. También Long Beach es una ciudad con un puerto, el segundo más grande de los Estados Unidos, y sabemos que barcos se están vendiendo de China ahorita. La gente que está trabajando en ese barco se está quedando en los barcos y no están viniendo a los Estados Unidos. Eso es algo que el Coast Guard de los Estados Unidos está trabajando con nosotros en este programa. Y estamos trabajando ahorita con todos nuestros todas las organizaciones en el county y en el estado en esta situación. Muchas gracias, pero estamos trabajando bien duro en esto, que la gente debe, por favor, que se comunique con la ciudad y con nuestro health department. Thank you guys very much.